next question, because you know that the images of upper limb and lower limb, especially the bones, they are very, very important for you. If you look at this image, now this is the x-ray of, you can very well say x-ray of the hand, and over here you are having this arrow and you have to identify this arrow marked structure. So if I see this image over here, now when this image comes to us, what happens? What happens that normally we have this notion in our mind that, oh yeah, it is very easy, we can attempt it. But when we start attempting this question, yes, very correct, I can see a lot of responses. But when we start attempting the questions, sometimes the basic questions also, in that you have certain confusion, and which should not be there, and it should be cleared by today only. Now, first of all, when you are seeing an X-ray, you should be able to tell which is the medial side, which is the lateral side. So what is the medial side over here? This is the medial side, this is the lateral side, and you will decide, you can very well decide with the help of the thumb. In the thumb you are having 2 phalanges over here, these are the 2 phalanges only, and in the rest of the fingers you are having 3 phalanges each. This one, this one, this one, this one, this one, this one. So you can very well identify with the help of the thumb. Yeah. Okay, so the mnemonic over here, I can see the mnemonic, Farhad Jacknight, yes, the mnemonic is, she looks too pretty, try to catch her. Okay, now over here when you are using this mnemonic, she looks too pretty is for the proximal row, and then after that 4 words, try to catch her, that is for the distal row, and the arrangement is from lateral to the medial. So this mnemonic will help you only if you are able to identify the lateral side and the medial side. And now let us focus it more over here. This row is the proximal row and this row is the distal row, and now you apply your mnemonic. So now when you apply your mnemonic, let us try to identify this. Now this bone is scaphoid, this is lunate, and when you come over here, what we see is one bone is like this is triquetral, and the pisiform is overlapping over here. So the pisiform is overlapping over here. I will draw in a different color. Yes, this one. So there is a round bone over here. There is a small round bone over here which is pisiform, which is a pisiform. The pisiform and triquetral, they are overlapping with each other. So we are not able to see it separately, but this is how you will identify, this is triquetral and this is pisiform. Now coming to the distal row. So let us see the distal row. We will identify this too, going from lateral to medial. This bone is trapezium. This one is trapezoid. This one is capitate and this one is hamate. Yes, well done. So you have all identified all the carpal bones over here in an X-ray, or it will, if it comes in the image-based question, you will be able to identify. And now when we see the arrow over here, the arrow over here is on scaphoid. So now we know that this is the scaphoid bone, and when we come over here, so the answer of this question is scaphoid. Yes, very right, Isha Singh. When we are talking about the triquetral, if you see over here, this is the triquetral over here and the pisiform is present just over it. So they are basically overlapping. So again, if you see, you can see one shadow in this way and another shadow is coming which is overlapping it. So that is, these 2 bones are overlapping each other.